Japanese Culture Nursing 480-804 by Jonathan Martin. Introduction to Japanese culture. Japanese culture is a culture steeped in tradition. Many of the traditions that are commonplace in Japanese and Japanese American society may seem odd to those who are unfamiliar with them. Many Japanese and Japanese Americans follow a code of ethics that has its roots in Confucianism and focuses on family and social order. This is referred to as filial piety. This type of social and familial order is very important to the Japanese. Filial piety was felt to be extremely important. Children were expected to obey and respect their parents, bring honor to their parents by succeeding in work, and support and care for their parents in their old age. Knowing the family structure and expectations of the Japanese will help the nurses be able to provide culturally competent care to these enigmatic people. Prenatal care for Japanese women. Patients in Japan are seen on a first-come, first-served basis, which is very different than how we do it here in America. We make our own appointments here in America, which can be a source of anxiety and confusion for the patient and their family. They're not used to doing these type of things, so we may just need to take a little bit of extra time to explain the process and how that they're going to be doing this. Now, it is also important to note that the husband is usually heavily involved in scheduling and taking the patient to and from these appointments. So we need to kind of be speaking directly with them also when we're talking about setting up these appointments for the patient. Also, we need to explain to the Japanese women and their husbands that the paperwork that we give them at the beginning of the services when they come to the office, that many Japanese women are not used to signing a contract for medical services, so this can be a source of anxiety for them because they don't really understand what they're signing, and also their husbands may not understand it. So a little bit of extra time may be needed just so that we can explain the legal jargon and the medical jargon that is on them, and they'll have a good understanding of what they're signing. That way they don't have any added anxiety or worry about those documents that we do require here in America. They also, a lot of times, do not understand the need for a urine test for a pregnancy diagnosis. Routinely, this is done by ultrasound in Japan, and they don't do a urine test over there. So they may think that you're just trying to find something wrong in their urine or something like that. They don't understand it fully. The patient may also need to have an ultrasound done just to make them feel more at ease. If the ultrasound is not done, they may question the quality of care that they're receiving, and they may not trust the physician and the healthcare staff that is taking care of them. So to try and alleviate those worries, it may be just prudent to just give them an ultrasound so they feel more comfortable. Also, it is extremely important to note that Japanese on the whole is a very modest society. We need to provide privacy for these patients. It is common practice in Japan for them to have a shield, or not necessarily a shield, but a curtain that covers the patient during a pelvic exam. So there is no interaction between the physician and the patient at that time. The physician's doing the pelvic exam, and the patient cannot see what they're doing. Where this is very different than in America, when the patient can look and interact directly with the doctor. So this may be a place where we can just provide the patient with a drape so that they actually don't see the physician, to make them feel more at ease. It is also important to provide them with same-sex caregivers if possible because of that modesty. When doing exams such as a pap smear, it is important to remember that in Japan, these type of things are routinely done, but they're not routinely discussed. So when we're doing these type of exams here in America, we typically talk to the patient about why we're doing them. That is not common practice in Japan, and it may actually cause the patient to think that you're looking to diagnose them with cervical cancer or something like that. So we need to explain that, yes, we're doing it, but we just do it just as a screening tool, not as a diagnostic tool at this time. Also, we need to provide appropriate prenatal education. All of the education in Japan that these women receive are from the government, and they get a very large book that has pretty much everything that they're going to need in it. Most of the education that we give patients here in America comes from bottle makers and also formula makers, which can be very confusing when we're trying to promote breastfeeding, but here we are giving them all these education pamphlets and booklets and things like that that are coming from places that are trying to promote bottle feeding. So we need to really educate them that, yes, we are trying to promote breastfeeding, as breastfeeding rates in Japan are well above 90%, so this can kind of confuse the patient. Also note that in Japan, women typically return home to be with their mothers prior to and after the due date to receive help with their baby. So unless they have a large family unit here in America, this may not be possible for them, and it may be a cause for concern. So if there's any type of family that they have available and things like that, we may need to, have a conference with them and before the baby comes, just to kind of give them an idea of what they can expect after the baby's born. Also, we need to note too that it's not typical for a husband to be in attendance for the delivery of the baby, so we don't need to try and force them, because it may cause some anger or some feelings of anxiety, amongst the family members if the husband's being forced to do something that he doesn't want to do. A lot of them have said that they actually feel like they're being forced to be in attendance for the delivery. We also need to provide them with information about their hospital stays. Hospital stays in Japan and in America are very different. The hospital stays in Japan are usually about 5 to 7 days for a vaginal delivery and about 3 weeks for a cesarean section. And most of the time in America, we have the patient discharged within 36 hours, even after a cesarean section. And 2, it will be important for the nurses to note the cultural differences that may mask the signs of postpartum depression. So we need to be extra vigilant when we're assessing this. Japanese culture care across the lifespan, 0 to 17 years. Circumcision on a male baby is virtually an unknown practice in Japan. So if we approach the mother and father about this, they may not understand it and may not understand the reason for it, and may kind of freak them out. So we need to be very careful when we're talking to them about these practices and just let them know that why we do it and why some people actually want to do it. Now, while here in America, we also do routine tests for hypothyroidism and phenylketonuria, in Japan it's also common practice for them to do a test for neuroblastoma. So they may request this type of test, or it may need to be offered to the patient. Immunizations are also given differently in Japan than they are here in America. They actually give immunizations one at a time and never when the baby is sick, to where here we may give them 2 or 3 at a time, and also if the baby just has like a small cold or something like that, we still may give them those vaccinations. So we may need to just take time with the patient and assess their beliefs and then follow those beliefs. Routinely, they also give vaccines for Japanese encephalitis and tuberculosis, to where we do not give those in the United States. So we need to explain the different types of immunizations that they'll be receiving. Also, we need to keep in mind the concept of filial piety when the family is making a healthcare decision about the children. Usually everything goes through the husband or the head of the household, and he's the first one to make the decisions concerning any healthcare choices. We also need to remember to provide privacy for children and adolescents as well. If the children are young, have their parents present for procedures or treatments. This will be help them with any anxiety or fear that they might have. We also want to provide same-sex caregivers if at all possible, especially for teens. This is, goes back to the modesty thing. They feel very uncomfortable with other people looking at them. And according to filial piety, the eldest son is usually the second one to make healthcare decisions if they're old enough. And usually they want to be about adult age, but most of the time their beliefs and their decisions will align with their mother's wishes. Care across the lifespan, 18 to 64 years. Courtesy and thoughtfulness are particularly valued in the Japanese culture, and these would be appreciated during an assessment. So we need to make sure that we're taking into account and being courteous to these people. Avoid direct, blunt approach when speaking to Japanese patients. Japanese are typically indirect with their interactions anyways, so we don't want to be very blunt with them, as this will not get the type of interaction we're looking for with them. We need to screen them for hypertension and type 2 diabetes and give them dietary counseling as needed and provide them with literature. These are two things that tend to come up a lot because of the type of diets that they have. They eat a very salt-rich diet, and they tend to be diagnosed with type 2 diabetes later in life. We need to try to promote overall better health with them and wellness, as Japanese people are very receptive to it, and they don't mind taking in new ventures essentially to promote their health. And Japanese are very prone to lactose intolerance, so if we're counseling them about osteoporosis or anything like that, we also need to take that into consideration. Japanese culture care across the lifespan 18 to 64 years continued. They may avoid cancer screenings as they feel the physician is looking for something bad, and that kind of goes back to their religious beliefs in Shintoism and things like that. They don't like to be screened because they feel like something bad is, or they're actually just looking for something bad. Also keep in mind that they may not have healthcare disagreements in the open. This is considered shameful and negative against the family name, especially if they're a very traditional family. We need to approach the appropriate family member when discussing any health-related information. So if they are very traditional, we need to keep in mind that we need to probably be discussing everything with the father first and then go from there. So the older adult in Japanese culture, they're not likely to live in a nursing home. They will most likely live with their family who will provide them with care. And this has to do with that filial piety where the young are going to take care of the old. They also may rely on Shintoistic beliefs concerning any illnesses and may think of themselves unclean. Most Japanese embrace Buddhism later in life and see death as actually a natural part of life as opposed to that Shintoistic belief of illnesses and being afraid of things like that. So they also do not usually believe in being organ donors and want to die intact. So organ donation may be a touchy subject with them, so we need to take care in that regard as well. The older adult may also defer all their decision-making to their family, and particularly the oldest son. So they may make their own decisions, or they may decide, I'm going to let my family do it, and this is who's going to take care of it, and the oldest son will kind of be the spokesperson from then on out. They may also use something called Kampo, which is a traditional form of medicine in conjunction with their medical treatments. So if they're getting any type of medical treatments for whatever it is that's ailing them, they may also include things like acupuncture, any type of herbal remedies, and shiatsu to help them in healing themselves. If they're faced with a terminal illness, they also may adopt a stoic attitude toward it called shikata ganai, which translate to essentially, it cannot be helped. This takes the feeling of failure away from the patient and their families, so nobody really feels bad and nobody really takes a blame for anything. And to sum it all up, many Japanese are said to be born Shinto but die a Buddhist, and what that means is they essentially may fear illnesses and things like that, but as they get older, they realize that just death is a natural part of life, and they kind of become more accepting of it. They place a heavy importance on family and social order, so keep that in mind when you're having your interactions with them. They believe that mental illness is also something that brings shame to their family, and they may not seek treatment because of it. So they do need to be screened for these things, and then given the appropriate treatments and things like that, if possible. Japanese are modest, indirect people. Great care should be provided to maintain their dignity and courteousness at all times. We need to provide them with good education, to women especially, and thoroughly explain all tests and procedures as to not confuse them or cause any added anxiety. We need to promote healthy behaviors, routinely screen for hypertension and type 2 diabetes, and Japanese people actually have the longest lifespans of any country on earth, and many people live into their 90s. When we approach end-of-life issues, we need to do it courteously and with respect, and if a traditional family, respect their belief in filial piety.